Good evening. It's evening in Israel. You can see my eyes. It's evening, but I'm awake and I'm ready for this show. My name is Dr. Tovah Goldfine. This is TMS RoundTable. I am here with my wonderful friend and professional partner, Rose Hoy from Melbourne, Australia. Good morning, Rose.
Good morning, Tovah. Good morning. Now, audience, today we haven't asked a guest to come on. What we wanted to do was, because it's public holiday time, that we decided that we would just talk about our journey and how we came to be working in this area. Now, it's important to see if you look at us, I don't mean physically, but we've come from a medical healthcare background. We're not from alternate medicine. We're actually from that mainstream that has allowed it, what's happened is we've actually become aware of how the mind is the computer of our bodies, so to speak. So our mind directs us into being fearful because there's some danger out there. But unfortunately, the fearful feeling remains in us, remains in our bodies. So as time goes on, we then recreate that fearful feeling in other situations. And then we end up with chronic pain because our body is on alert. Our vasovagal system is activated continuously. It's like keeping the tap running all the time.
Right.
And you've only got a limited hot water service and someone leaves the tap on. Well, you're going to end up with cold water. So if we have our tap on all the time, we're going to end up with pain, with some sort of suffering, whether it's pain, whether it's autoimmune illness or whatever. It's going to run out, so to speak. And, you know, if you think about it, diabetics, for example, we provide insulin for them because the insulin, I can't think of what the name of it now, where islets of Langerhans, where the insulin is created, has actually run dry for the sake of trying to keep the body in situ. So we're wanting to talk to you, A, about how we came to do this sort of work, and B, how you can become aware. And in your awareness is your recovery. Mm-hmm. Now, I put up a little film on Facebook about falling forward. I hope that some of you saw it because we want to help you to fall forward into your true self, not the self that allows other people to dominate what you say and do, or for you to be compliant and be what other people think you should be. It doesn't mean to be obnoxious or to be sweet and lovely, but to be your true self. So your true self allows your angry feelings, your sad feelings, your joyous feelings, your immense love to vibrate up through you, like vibration in your body.
And now, what happened, what I want to just comment, what Denzel Washington was talking about in the middle of his he was giving a graduation speech, and he was talking about how we have to fail to succeed. And, you know, we see that in all religions and all philosophies, how we have to fall and get down. So I think what we're teaching people is how to fall and how to see the fall as, you know, a step in the direction, as opposed to I failed. And because the society, parts of society in the medical system is, well, if you fall, something's wrong, stay down there, don't move. We're like, fall and get up. You know, it's a little counterintuitive.
Yeah. Now, moving along, Dr. Tovah is originally a chiropractor. So that's her medical background. But again, she will tell us in a moment about how that medical background helped her to understand the body. But it didn't help her to create that healing sort of situation where, you know, initially the patient comes out better, feeling better, but then the patient comes back. And that's very frustrating for a therapist. For myself, I'm a registered nurse and a midwife. And I also found, as I was learning my ISTDP training, core training, I'm seeing all my patients over the years that I could have helped them to get over their medical issues if I'd been able to ask them how they felt.
Wow.
about what was happening to them, how they felt about their family members, even the doctors, how they felt and how they responded, and if they'd shut down or not, and help them to reflect. And now with my ISTDP training, I can actually help people in another way, in a way that creates deeper self-reflection. And that's why this combination of the work that Tovah does and the work that I do fits in, dovetails, as they say. Because I work with the emotions and Tovah works more strongly with the mind, with allowing the mind to be more open. So Tovah, in your words, please tell us a little bit more about your journey and how the frustration you felt that you've spoken to me about of having patients coming back and not being healed.
I definitely look, I think, growing up with a mother who had multiple sclerosis, I had some kind of understanding before I went to chiropractic school about the body and the disease and, why my mom and what's going wrong with her body. So I started to question much earlier. And then, I tell people on the show, on various shows, that I took her to see Dr. Bernie Siegel, and he was giving a lecture in the University of Pennsylvania, a big school in Philadelphia. And there was a book that I got called Love, Medicine, and Miracles. This is before I was even in chiropractic school. And I'm seeing this book, and I'm seeing this medical doctor talking about cancer and healing. So we go to hear him speak, and she stands up on her walker, and she raises her hand and says, "Why did I get MS?" And he said, "Well, you were responsible for it." And I was like, whoa. I felt that. I was like, whoa. But I felt bad for her, but I knew that it meant something. And years later, I still talking about it because it's really how he fires. And he's actually very close with David Hanscom. They've done podcasts together, and they're buddies. And they kind of like, how Hanscom's like, he's very straight and kind of like, well, that's the way Bernie Siegel is. Like, you got to, they're doctors that have gotten understanding the emotional, but they're very straightforward with like, you got to heal, you got to play, you got to get better. And, me and you were a little softer, but that shaped me. I wanted to keep searching for some meaning in why people get sick and why certain people get sick and why certain people don't and why certain people heal. Fast forward, chiropractic school is very philosophical. We talked about this innate intelligence that's connected to universal intelligence. It was very philosophical. But regarding what you said, we would see people in the clinic, for 12 to 25 visits, and then they would be better. And that was not happening. And we were not told to ask, well, how are you feeling and what's happening? So I had these these conjoining philosophies coming at me growing up. And then and I went back to school years later. I had dropped out of college and went to professional school. But I was drawn to this work because 10, 15 years ago, I was drawn to this understanding, and then met Michael Galinsky, and then met you, and that's a whole nother podcast. But today it feels so good to have the support of a community, of course. Like I always say, I work with doctors in America, I work with doctors in Israel that are very open-minded and talk about integrating. And I think what you and I are doing is integrating TMS methods about journaling and mindfulness and exercising and moving with ISTDP, which is really...
We do it in the moment.
I brought up this word the other day with a patient, going into the resistance. So ISTDP is going into the resistance, and so your work has taught me so much. I don't know where I'd be. I'd be a very different doctor today. I hadn't been hanging out with you for close to 3 years and learning about accepting and recognizing and acknowledging and compassion. I mean, you sort of brought me to that place where I feel very blessed to be working with you personally and professionally, learning a lot.
Well, thank you. Now, ladies and gentlemen, Tovah just touched on the fact that it was she and I promoting Michael Galinsky's movie All the Rage that actually brought us together. Now, Michael Galinsky's All the Rage movie, we actually recommend it to people because it's a visualization of a journey, of Michael Galinsky's journey and also others' journeys, so that, like someone with CRPS, which is so debilitating, they can see the pressure that the lady on the movie put herself through to meet all the external criteria. So it gave a visualization. So when Tovah wanted to actually expand the idea with the COVID lockdown, that we could do something for other people, and we didn't sort of really realize the power, actually, did we, of social media when we started off. So now we're able to actually see people individually or see people together. So we do a combination. So some people have got quite a few coaches or quite a few doctors, and they maybe just want to see a therapist. Other people haven't seen, or it hasn't been successful for them. So they'll just see Tovah to sort of get a grip of what's going on for them. Or other people will actually join and we'll do Tovah will talk about what's happening, things they can do. And one of the lovely things that Tovah puts forward for people is about movement and exercise. Now, if you've got somatic pain, if you've got any sort of pain, the last thing you want to do is move. But it's in actual fact the first thing you want to do. And part of that is that falling forward. That's why when I saw that video, I thought it's so important for people that have lost faith in themselves and confidence in themselves to fall forward. And one of those primary things that Tovah always promotes is movement, exercise, breathing, all those physical things.
I want to talk about, thank you. And then I want to talk about the ICDP point of view of this, because what I've been privileged to learn is a lot about the parasympathetic and sympathetic nervous system, which you learned in nursing school, and I kind of learned also in chiropractic school, but I have such a different point of view. And when I understand now what's happening when we feel threat, and when we're in pain, we feel threatened. And with chronic pain, it's a perceived threat. It's not real. It's not dangerous. This is what we're learning about most chronic pains. That's in the head. It's in your body, but the solution's in your head. And with the exhale and with the inhale and the exhale, the parasympathetic nervous system, and I thought these words were like, I don't want these big words, but they mean something. Because if people hang out in the parasympathetic nervous system, if that's where they hang out and they become friends with, and they hang out with their emotions in the parasympathetic nervous system, they're going to be able to continue healing themselves. How? With the breath. And you've taught me, and we learned this together reading the presence process, that when we breathe in and we breathe out, the exhale is a little longer, and we're bringing calm to our nervous system. We're bringing anti-inflammatory responses. We're calming down our stressors. And also what you and I learned together is that's a response. We're learning to respond now to our pain and not react, because the pain is a reaction to our emotions. And we get to respond now, and that can bring calm even for some immediately. And if not, keep doing it. It's because you're stubborn and your body's strong and you're refighting. I always say strong and sensitive people get TMS. We're strong, sensitive people, and you're as strong as your conflict is as strong as your healing can be. Right, Rose?
Yes. I would expand that a little bit more.
Please.
I would be more inclined to say, yes, breathing gives you that pause. Not to worry about the vasovagal system, but to find a pause for yourself. It doesn't matter what that pause is. But breathing means it's conscious and it's unconscious. We can regulate our breathing, but we can't always consciously regulate our blood pressure or our other.
So talk more about
things.
how can we do it? How can we consciously regulate our breathing?
By being aware.
By being aware.
Yes. And see, part of healing is awareness. When we're just going downhill on that bicycle as fast as hell, well, we're not going to be aware of anything because everything's going to be sliding past us.
So and I'm scared. I'm scared, and the pain is hurting me. Okay, how do I be aware?
But it's all right. But it's all right, Tovah. We're together.
I'm just playing. I'm playing because this is really what, like, but I'm in pain. So you even taught me. So just be with that pain. It can hurt you.
Absolutely, it can. It does hurt, but the consequences are remain the same. So the breathing, for example, but many people find the breathing and then say the journaling or the somatic tracking, right. All of those things, right. They all right. add up. Right. Now, most patients can't do it for any more than a few moments, but that's fair enough because they needed to be on alert once upon a time. Right. And that's why, for me, as a therapist, the whole idea of attachment theory is so prominent. Because as a child, the child has had to be alert. The child has had to be trained to be alert, to always be watching out for mum. Like you, for example, said about your mother having MS. Well, you would have been on alert from day one. As soon as she became unwell, you would have been on alert to make sure she was okay. You took her to Dr. Siegel. You didn't see it as that, but from a therapy point of view, yes. Right. You were on alert. Right. So you would be a good candidate for having some sort of pain issue or whatever, if you know what I mean. Right. So most of our patients, when we see them, they usually have a backstory. Mm-hmm. And that backstory has created the fear. Can just go back now as an adult and think how it was for you as a teenager or preteen when mum wasn't well and needed a walker. Couldn't drive you to school.
Most of people we talk to, I started to immediately go into survival mode and stuff my feelings because that worked. That worked for me.
Yeah, but also think about how angry you were that she couldn't drive you to school, that she couldn't go to things.
I was embarrassed. I was embarrassed that she was sick.
That's right. But what do you think embarrassed is a cover word for?
Sadness, fear, anger.
Yeah, anger, yeah. So embarrassment was a cover word for all her feelings. I was embarrassed about how other people saw my family.
Mm-hmm. Something was different about me because she was in a wheelchair.
Yeah. And that angry feeling towards mum, that she couldn't be like other mothers. All of that gets all mixed up in a child. Yeah. Sorry, Tovah, to use you as an example, but it's just so beautiful. It's such a beautiful story. And now you're drawn to healing.
She's the reason why I'm such a good doctor. Because I feel like I can help people because I understand. And also I read something the other day about, how therapists were in this relationship with clients and we're learning and we're healing. And you and I talk about that often. It's a safe place for both the therapist and the client to create safety and
harmony or
relationship.
Yeah. And
so let's talk a little bit about the journaling, which you and I know that, some people will even ask you what you think about it. And, it doesn't work for everybody. I don't think none of this is black and white. Everyone finds their own healing. I like to offer different options and different insights of how people can get close to the repressed feelings, they can calm their nervous system. But not all the things work for everybody. And a lot of people become very resistant. And like I was talking the other night to someone, you've got to go into the resistance. What is Dr. Abbas's book?
Reaching through resistance. Reaching through resistance.
Through resistance, which is such a powerful, because when people are scared, they're resisting.
Yeah.
They're fighting.
Yeah. Well, that's why with ISTDP, we do it in the present moment.
What do you mean by that?
Well, in that present moment, you actually ask them about their feelings about maybe you
Right.
or about their loved ones. And then we see it in the present moment, what actually happens. They can see the anxiety coming up or the defenses coming up, the sarcasm coming up, or maybe the anxiety, which could be a pain in the stomach. It could be cognitive perceptual disruption, like becoming vague. All of those things, you can see it as the person reaches out and makes good eye contact. Because one of the lovely things about ISTDP is that it's based on as much eye contact as possible. And then the patient can see that they look away when something is troubling them, for example.
Wow.
And then you can draw them back. You don't actually say, oh, you've looked away.
Yeah.
But you can say, well, what happened to you just in that moment? And then the person can reflect. So what I'm doing, if you think about it, is I'm doing reflection, I'm doing journaling, I'm doing all of those things in the present moment.
It's so true. Very good point.
Yes. And this is what I love about what Davin Liu discovered, because he was a psychoanalyst, and psychoanalysts spend 10 years with patients on the couch. He wanted to make it short term, and he realized when he was doing his own psychoanalysis that he used to get annoyed with his colleague who he was doing the psychoanalysis with. So then in the therapy room, he allowed himself to actually see how that panned out for patients. And then he was able to draw it back to maybe 40 visits instead of to 10 years.
Wow.
So over 40 weeks, which if you think about it, is 40 hours.
Yeah.
It's a working week.
Yeah.
It's a working week to get better.
Right.
Yeah.
Very good point.
Yes.
Very good point. So, I want to ask a question. Maybe there'll be some questions in the from the listeners.
The chat. Yeah.
But I sometimes, now that I've learned a lot of this work from my work with pain reprocessing therapy and just my experience around you and the ISTDP, which I'm not an ISTDP therapist, but you are. But I use some of the tools that I've learned, and I see that, it's so hard for many people, including myself, to look in the mirror and say, I love you, or you're going to be okay. I had a patient last week, and I was working with her back, and I knew the pain was, the muscles were in spasm for completely TMS reasons. She was very triggered. And at some point she was walking around and stretching, and I asked her to look in the mirror and say something nice to herself, and she couldn't. And she started to cry. And I thought, well, maybe I brought that up too soon, but that's not the point. The issue is that, why is that hard? What's happening there that we can't look in, we can't love ourselves? What happened? And let's talk about the connection between loving ourselves and healing back pain. That's what I want to get to.
Yeah. And how did you go with her?
Well, it helped her. It helped her relax in a way. Like, she couldn't do it, and I was like I was just noticing that, and she was, she got better. She got better because that incident happened. There was that disconnect of, because we were standing in front of the mirror, and she couldn't say it.
Yeah. So she actually realized how she had actually shut herself down. Yes?
Yeah.
Yes. So did that bring her a feeling of warmth? Of what do you think it brought her?
I think initially it was a bit of a, she couldn't do it, and it upset her.
Yeah. But you said then afterwards she was able to do it.
Then she felt better, but I think it released tension, but she couldn't do it. She looked and she couldn't say it.
Yeah. And then when she did say it, or she didn't say it at all?
She didn't say it. I just knew she felt better later after she called me and said she felt better. But there was an interesting disconnect. When I asked her to look in the mirror and say something compassionate to herself, because she was really doing a great job, and she couldn't.
Yeah. Do you think now, if we use that lady as our example, that she was maybe not able to actually, how would I put it, able to ever acknowledge what she did as being good or well, or having been told by adults as a young person that she didn't do it right, and that nobody, after the correction, nobody allowed her, we'll use her as the example, to feel good about herself. So she was burdened.
Right.
You see, the whole story fits in together.
Right.
That attachment story stays with us all the time. I often think about a piano accordion. You know, when you shut it up, it's like that. But, you know, for 80 years, it's the same story all the way, up and down. It's even. And all of these joys and sorrows and that come about. But one of the things, Tovah, that came to my mind as you said that, was that once she would be able to say it, the warmth in her body would come up and her body would soften.
Right.
And then the back pain, okay, it might only be a microsecond, but that's all you need.
Right.
Because, you know, that little microsecond is all you need to know that there is relief out there.
Well, that reminds me of, I'm sorry, go ahead.
Yeah. It's that warmth, that heartfelt feeling that, yes, I'm an okay human being.
Yeah.
Because if we've been reminded all the time of all our inconsistencies and all the things we haven't done quite right, you know, many of us have got children that don't do what we want them to do. So have we done it wrongly, or are they independent?
Right.
So if we take the blame and it's about us, we're going to get back pain, for example. I mean, that's just an example.
No, it's a good example, because that's why, you know, it's like, what does saying I love you have to do with my back pain? And then, you know, I've been a little bit more involved in the Love Heals movie, because we brought it to Israel, and so there goes the water up, fire down concept about warming your belly and bringing warmth and energy and movement. We're back to the movement. Okay, we're back to understanding the connection between our feelings and chronic pain. You know, and of course, ISCDP, people come to you a lot for anxiety, and then they realize that, well, their IBS got better.
Well, that was one of the wonderful things when I did this training originally, and people would come to me about relationship problems or self-esteem, etc. And then they'd say, well, you know, I've always had reflux, or I've always having to take my Lanta, and I notice I don't need to do it anymore. Yeah, or I can do all these exercises, or, you know, I used to get cramps, and now, you know, it's just a reflection. And then, of course, Michael Galinsky's movie came out, and there was a crowdfunding invitation, and I took it on board because, as a nurse and a midwife, I saw all these problems. You know, like even in labour, the patients that weren't afraid of their contractions, their labour was easier.
Wow.
But the patients who were afraid of their contractions and thought that it was the end of the world, they took longer. Yeah. I mean, there's variances. I'm just generalizing at the moment. But it's that fear that holds us back. Yeah. And and I've got 5 children, and the first two were a bit nerve-wracking, but after that it was fine.
Were you aware of your relationship with the pain?
Of course. Oh no, relationship with the fear.
The fear.
Yeah. It's the fear, the relationship with the fear. Oh yeah, what have I got to be afraid of? No. I'm really looking forward to, you know, in 8 hours I'm going to have a little darling heart on my arm. Yeah. But saying that, any ladies who are out there and thinking about that, think about the idea of going through the contractions and then the responsibility on the other end. And then you end up with back pain or a headache. The responsibility of, am I going to be a good enough parent? Am I going to have it all right? You know, it's all in the brain. It's going back to the brain all the time. And that's why with Tovah, talk about neuroplasticity now and the brain. And
I want to bring up something really amazing. And this has to do with PRT. Excuse me, but you taught me this because it happened again. I see this more and more that you made me aware of it. And it's so fascinating. And I know the listeners will be like, this is complicated, but if we understand the patterns, because underneath the pain is anxiety. And underneath the anxiety is some deep core feeling driving the anxiety. And if we can get to the anxiety and understand our triggers, we've not only prevented the body from having chronic pain, we've already in the healing process. And we become our own doctors. So what I notice is that the pain will get worse and the anxiety will get bigger, and then they'll get scared again. And I'll be, no, now you're in a different level. It's a good thing. Stay with it.
Yes.
Go on. Fall forward. Stay
exactly.
with the cycle.
Yes.
You're actually getting to the you're peeling another layer of the onion. So it's powerful philosophy to understand, not what came first, the chicken or the egg, but the anxiety is, if we're aware of that, it won't turn to pain. It won't turn to disease.
Yeah. Look, could I also mention that the human condition is naturally towards fear because we're vulnerable. Yes.
And and let's just talk for a minute, because of our ancestors, that's the way we lived. That's the way we survived.
But we don't have decent claws to defend ourselves. So we need to be in a community, in a group. So if our group is reluctant to allow us to have feelings about things that we're hurt about or sad about or joyous about, well, we're going to have to shut them down to stay in the safety of the group. So we're always going to be on alert.
Or we have defense mechanisms.
Yeah. Well, the defense mechanisms are more to hide away the anxiety. The defense mechanism, the sarcasm, the God, you see, I'm all the defenses. See,
this is important, because to our audience, if you become a little bit aware of some of your defense mechanisms, you're rationalizing, sarcasm, you're laughing. I might feel insecure, which is a defense mechanism against that. I'm feeling nervous, anxiety. Yes. So if we become aware of that, we can say, "Oh, there's Tovah.
I was anxious."
Yes.
And it's so easy and it's so handy, because I think that once a person is sort of has chronic pain or any of those sort of symptoms, it's wanting to come back. But when you realize what's happening and you say to yourself, oh, I've become anxious because I feel like I'm being judged, or I haven't done a good enough job, even for myself. So there's a feeling of being judged from outside, or that internal judge. And all of that just keeps on hammering. So once we spot that, yes, we're getting defensive, we're laughing about something that's sad, something that's heartbreaking, and then the patient laughs. Yeah. And you say, why are you laughing? That's so sad. Right. And then the tears come up. Right. And then they'll say to you, but I've never been allowed to be sad about something. Right. As soon as I was sad, my mother or my father would say, don't cry, it's okay. But in actual fact, crying is part of our very system. And over the years, the other thing I've found is some crying is about frustration, whereas other crying is about sadness. And the interesting thing that I've noticed over the years is that crying out of frustration are sort of like hot, heavy tears. But crying out of grief, they're cool and they're soothing. Wow. And they warm the heart. Wow. Yeah. So there's all of this sort of variance and, subtle changes in our body. Yeah. And if we begin to notice those subtle changes, we'll know, yes, those tears that want to well up in my eyes, they're angry tears. Yes. Okay, so that's a shutdown, shutting your body down. Grief brings it up. Yeah. And there's a flowing. You've lost your mother, you've lost your father, you've lost a relationship. There's sadness. Yeah. That sadness and that grief needs to be nourished and allowed to come up, because it's not going to stay forever. It's going to come up and it's going to die down. Yeah. And come up at different times. And it becomes part of our, like grief, for example, it doesn't just go away. It's part of what our existence.
Yeah. So we have to, like Michael Brown talks about, we have to integrate that, or we have to integrate the past
and recognize it.
Great point.
Yeah.
Great healing insight. It's like we're not here to get rid of our feelings or our trauma. We're here to integrate it. And
integrate.
Michael Brown,
and acknowledge it.
Process will talk about bringing the past into the present as one, not separating everything. It's one.
Well, that's what ISTDP does. Yeah.
Exactly.
And if you think about journaling, meditation, all of those other things, it's allowing that past fear to no longer own us. The fear earlier on, you've just got a new job, for example. So there you are, you're trying to please the boss, please your co-workers, please all these other people, and you almost lose your focus on doing your job because you're trying to please others.
Yes.
So that same story goes across the board. I've used that example just because you know what it's like when you've got a new job or a new role. Or look at you and I when we first started doing this program. Oh my God.
Oh, Rose, I used to interrupt you so much and you used to get upset. And now I don't interrupt you as much. And also you don't get so upset.
Yeah. But like I used to write out a script.
Oh my God.
So that I had it right and all of that. And then Tovah would want to include everything instead of including just whatever the topic was.
Yeah.
And that's our anxiety, and we've recognized it.
Yeah.
And now we just flow freely. Whatever comes up with our guests, although admittedly we need some background on our guests so that we can actually build what they do. And in saying that now, I'd like to mention, and you too, Tovah, how we actually honor our guests, and like we feel that our patients or patients out there actually grow from seeing our guests. Our guests, whether they're hypnotherapy people, counseling people, other activity people like the exercise guy, what's his name?
Or the sound therapist, remember the sound therapist?
Yes, they all give that little gap, that little opening for a person to see that, yes, I'll go to the medical doctor and the medical doctor will scratch his head that he doesn't know and offer you some other medication. But what we're looking at is that whole person.
Yeah.
So that whole person can be integrated and not be afraid of their feelings.
Yeah. And the wonderful part, and I'm very humbled by this, both in my Hebrew show and this show, Rose, how we have been able to attract doctors to come on. I mean, the doctors freely want to come and share, and that is just so humbling. They take an hour out of their break. I mean, Schuberner would not even eat lunch, and Schechter would come in the evening, and Dr. David Hanscom's always ready to come. I think they love this work. They love that lots of them, they've healed.
The sharing. Yeah.
They've healed themselves, and they want to, it's very exciting, this community that we're involved in. And Christy Lee McKinley, I don't even know who you are. I'm so happy to meet you. Look what she wrote. And I don't really even know her. And so we meet so many amazing people. I'm just showing Christy's message here. Maybe you live, do you know Christy, Rose?
Yeah.
Do you know? Anyway, I want to say that we have been able to, people contact us and say, oh, you helped me. Or, on the YouTube, they've given us mostly positive feedback. Sometimes we get a feedback here and there, which is when you're successful, you will get positive and negative feedback. But people talk to us about, and I don't even know who they are. And Rose and I are like, oh my God, we've touched another soul. We're just two old grannies. And I do stop every now and then, acknowledge what we've been doing. And we're not looking at stopping. This March, it'll be 3 years.
Yep.
This March, 3 years. And we have a whole lineup of shows. We have a lineup of amazing people coming in the next few weeks even. And, list of people coming. So anybody out there that has a story that wants to talk about their healing journey, I say, don't wait till you heal. You come on the show right now.
That's right. Yes. And talk about it for other people to see that it's okay.
Yeah.
It's okay. And also that falling forward from Denzel Washington, you can't fall forward. Okay, let me rephrase that. The falling forward can be a failure, but you've done it.
Yeah.
You've done it and you've come back and you'll do it again and again. And I often use that Richard Branson story. I don't know how many times he failed, the Virgin Airlines guy.
Yeah.
Yeah. He had lots of failures before he had his amazing success. And you know, we find with somatic pain people, yes, a new issue comes up and they go back. And for me, ISTDP has taught me, or the training has taught me, that yes, another form of anxiety, a high level of anxiety has come up. And yes, you're going to go back to an old pattern. But you'll see that it's anxiety, you'll see your pattern, and then you can become aware of it.
Yeah.
There may be reasons that you need to do whatever it was that you needed to do, but you're aware. There's an awareness. You're not just driven all the time by this engine inside that's driving you.
I think it's so hard, Rose, for many of our clients and our guests, and they were successful, and then something happened and they lost their job or they stopped studying, and they see it as a success failure. They don't see it as anything else but.
Yes. Yeah. I wasn't good enough. And Neil, thank you for that. 10,000 attempts to create the first light bulb. Yeah,
right.
Exactly.
That's what Denzel Washington's, he talked about the fairs. But can you comment on how people can muster up their hope and belief? And I always say, you overcame adversity once and you'll do it again. You're just in your process of, how would you explain
falling back rather than falling forward? Yes. Okay. I'm falling back, but I need to fall forward. That's that microsecond of awareness. And that's why, it's important in your work and in my work to allow that moment to happen, that sense. Yes, I'm in charge. My brain is warning me that I'm in difficult waters, but I can handle it now that my brain has alerted me. My brain has alerted me that I'm feeling defensive, that I'm feeling incompetent, that I'm feeling overwhelmed. Yeah, yes, maybe I am, but I can deal with it. And that's that falling forward that Denzel Washington,
that may have to happen for people 1,000 times, 10,000 attempts. Because people like, I'm having a good day, and then I fell. I'm having a good day, and then I fell. And number one, Alan Gordon will say, well, don't even label the day. You're having a day. It's a day. So see it as a journey. Then, so part of it is this self-compassion, this patience, this lower your expectations, not being a perfectionist, small steps. This is the place we're going back to falling forward. This is all coming together as we talk about this, because if we could not judge ourselves and see the journey as opposed to the one step. Well, I'm having each day, because help me here. I lost my train of thought, but it's something, because I want to go back to the neuroplasticity.
Yes. The neuroplasticity. Yes. Would you mind, Tovah, if I use that as an example for people?
You may, please.
Okay. She became disrupted.
I did.
Yes. And that's what happens to us. And she just gave us an example. I gave you an example a few minutes ago of becoming disrupted. Okay. That's a form of anxiety where our amygdala kicks in and our neocortex is blocked. That's all it is. If you see it like that, it all makes sense. And there's no need to judge.
Right.
Yeah.
Good point.
Yeah. So thank you for that.
Yeah. No, and I probably do that 20 times a day. And because
that's right.
because
it's just about anxiety.
I don't stop and like I just accept it.
Exactly.
I've trained myself, my brain, that it's automatic. Okay, you're being human.
Yeah.
You know, and sometimes I don't have to come out of I don't have disconnect. I can just be okay. You know, because
isn't it lovely, Tovah, that we're actually using our own examples for people of how our bodies operate? Because that's what we're doing, isn't it? We're using what happens to us in conversation. We get disrupted because we're speaking publicly. Well, so that's a big deal.
You know, Rose, let me ask you, like, you're triggered a few times a day. Have you been triggered in the past couple of weeks? Did something upset you? You've been triggered? You had to overcome something? We're all going
we all have to. We've got Christmas and Hanukkah and now New Year. So
family,
of course.
Family.
That's right. Family, of course. Yes. Coming together, trying to do the right thing. And the Americans have had Thanksgiving and all of what that brings in November. All the families coming together and not being happy about how the goose is cooked or whatever, the turkey.
Or, you know, expectations of wanting things a certain way. I was disappointed the other day. Something happened with my children and I was so disappointed. I actually cried. And I was glad that I cried because I normally would like hold it in, you know, but I was alone when I got a phone call and something disappointed me. And I just cried and it was like this release of tears. And I think I felt sorry for myself. I don't think they were tears of compassion, but I felt really disappointed because I was expecting something with my grandkids and it didn't work out. And I was really sharing with myself this childlike, I was upset.
Really?
You know, and it felt like the sky was falling. It really felt like this is a terrible thing. And an hour later, it all looked different. My perspective
and it integrated, didn't it? It made sense.
It all why you reacted, and I didn't feel so bad about it. I didn't feel so in that moment. I think I could have had pain, but I was aware of how bad I felt. Not even so much about the disappointment, but something deeper inside. About the rejection or that, you know, wait, but I'm the grandmother and I need the attention. I wasn't getting what I need. Whatever it is.
Okay, now just hold on a minute. Could I use that as another form of example? Mm-hmm. The example for me would be, when else did that happen to you? And then if you were in therapy, for example, you'd remember that maybe your brothers took your bicycle off you. Something just flies from the past, just flies into the present. And you realize, oh my God, this has been the way I've been acting, as if that brother of mine has taken my bicycle again.
Right.
But it's in the past.
Yeah.
So are there any questions out there from any of our audience?
Well, I love what Neil is a therapist, but he himself has gone through healing some chronic pain and probably still is in its process. And Neil helps others with various autoimmune and chronic pain. Yeah. And he was sharing some good points about
you expressed it, yes.
Yeah, and didn't suppress it. And I recall many times of suppressing it because, you know, just get over it. You know, get over it. You know, calm down. Right.
Exactly. And, you know, these are little words that are said to us when we're younger and we don't have a response. Because if we responded, we'd be back chatting.
Yeah. Yeah.
You know, calm down. No, I can't calm down because Freddie took my toy.
Yeah.
And I can't calm down. But if you said, no, I can't calm down because Freddie took my toy, you'd also be in trouble.
Yeah.
So, so that pattern stays with us.
So Neil's doing some hypnotherapy and some kind of mind-body work. I don't know much about it. We're actually going to have the gentleman on next month, Steve Blake, who I think taught Neil. He's coming on our show in January. We'll talk more about that. But I have recently been studying the neuroplasticity work or the pain reprocessing therapy. And though you and I have done somatic tracking together and with clients, I learned it from this point of view from Alan Gordon's work. And it really was wonderful. It's been wonderful for me to understand, and studying with David Hanscom, and we all know about he's big on this threat safety, which we've used those words before, threat safety. And basically it's about bringing, when you're hyper vigilant or feeling anxious or feeling triggered, your dial is up. Your brain is on, high alert, and you're guarding and you're ready to literally, protect yourself. And inflammation's being created for protection. And there's a lot of research about when I have an anxious thought, I'm creating inflammation and my body's creating that to protect me. So the brain is doing the job that our unconscious mind is telling it to do. So rather than keep that whole, like a line is coming, once we become aware that our brain is on fight or flight and in the sympathetic, I'm using these big words now, place all the time. If I can become aware of that in that moment of being triggered and stop and breathe, inhale and exhale, or like sometimes you've suggested, take a walk out in nature, or a hot shower, or
a cold shower.
Cold shower. Hanscom will also mention humming and singing, journaling. Even if someone has to go smoke a cigarette, or I say, even if you have to go smoke a joint, if that's what you have to do, okay, then become aware and mindful of what feeling was driving that anxiety. Then you're not just shutting it down with these safety reappraisals. So in 1 minute, so I'm saying to you, it's best not to smoke a cigarette or a joint, but if that's what we do, then take the opportunity to go deeper, because otherwise you're not getting to the cause of the problem. You're shutting down the pain or the anxiety. But this is what sometimes even Schuberner will say. People are in so much pain, they're not going to be able to do pain reprocessing therapy. They're not going to be able to bring safety. So if you have to calm down your pain in some way, go ahead, but stay with the process.
Good.
So
that's why I wanted to interrupt you.
I want to hear you.
Yeah, because the thing is that when you go and have the cigarette or whatever you want, if that's your go-to, be aware that you're actually shutting down a feeling of anxiety.
It's true.
That's all you're doing.
Yeah.
Anxiety came up and it was not okay, and you needed to have a diversification. And that's why if you think about all the alcohol, sex, all of those things, they're all a diversification from your feelings.
Of course, we want to feel that dopamine. We want to have that dopamine high.
Yes. You go out with New Year's Eve, and like on New Year's morning, I noticed all the tins and stuff around. Yes, whatever the new year was coming in for people, and the fears that, it's a good idea to make yourself blind with alcohol. Yeah.
So very important. Very important point. Very important point. But
instead of acknowledging that tight feeling in your gut is anxiety, and you don't have to put something in there to stop it.
And guess what? When we get in touch with our feelings and we bring safety and we calm our nervous system down, we create our own cannabis. We create our own opioids. We create our own pain medication, our own cocaine, by our thoughts, by our calming, by our beliefs, by our compassion. The science of compassion and gratitude and praying will bring those chemicals, because we're a pharmacy inside of our body.
Okay. We've only got 5 minutes left, and I desperately want to talk about the fact that there's this emptiness, this loneliness in us. It's in all of us. And that's why our spiritual lives are so important, because that draws that together.
Yeah.
But if we neglect the fact that we have this emptiness and loneliness and want to obliterate it, we're going to remain in chronic pain. We're going to remain in addiction. Whereas the emptiness and loneliness, St. Augustine said, our hearts does not find rest until they rest in thee. Our hearts need that other part of us to be accepted, that there's this emptiness and this loneliness within us. And it's not bad. We've all got it.
No, and we also have unlimited resources inside of us to give ourselves what we need. We can ask for it out here. We can develop. We can, ask for what we need. We can delegate. We can draw people. But ultimately, we have the resources inside of us for the self-love, the self-compassion, the belief.
Yes.
I just want to bring up Betty's. Do you have to go, Rose? Do you have to go? Oh, because I wanted to bring up, I just want to acknowledge Betty, who's working on releasing her cervical dystonia. Well, it goes back to an alcoholic parent and child who did the death of her adult son. I'm feeling good enough, but you're working on it. And thank you so much for sharing that. It is a journey. Betty, it is a journey. And Neil, you're right about being your own best friend. This is very true. Rose, anyway, we'll be back.
Okay, before we go, Tovah,
yes.
I'd like to say to our audience, if they need any support, any help, or they want us to work with them, please contact us.
Yes.
You can make that initial, whatever you call it, contact. You don't have to fulfill it. You don't have to go ahead with it, but you're welcome to talk to us. And Tovah has become a speaker, a public speaker.
I just
deal
with my anxiety by helping people. So I'm out helping people all the time, and now I have less anxiety. Anyway, enough about me. Rose, have a wonderful day. I'm going to go to sleep. There's some people out there that if you need to express, please write on our Facebook feed and ask us any questions. You can always contact us. Rose and I, we meet you complimentary for a consult to see if it's something you want to work with. We love sharing what we do and helping people, being part of their journey. We'll be back next week with another guest. So stick with us every Monday and have a wonderful morning. Tuesday morning. Good to see you all. All the best.
Okay, bye. Bye. Bye.